What causes slow progress in cognitive rehabilitation? Imagine trying to rebuild a complex puzzle after it's been shattered. Sometimes, the pieces come together quickly, but other times, progress feels slow or even stuck. That's often the case with cognitive rehabilitation, especially for those living with brain cancer or other neurological conditions. Several factors can influence how fast someone recovers their thinking skills, and understanding these can help set realistic expectations and guide effective treatment. First, patient-related factors play a big role. Some individuals may not be fully aware of their cognitive difficulties, which can make it harder to focus on therapy or practice strategies outside of sessions. Motivation is also key. If someone feels discouraged or overwhelmed, they might not engage fully, slowing down progress. Fatigue and emotional challenges like depression or anxiety, common in brain cancer patients, can drain mental energy and make learning new skills more difficult. The severity and type of cognitive deficits matter too. For example, someone with mild attention issues may improve faster than someone with significant memory or executive function problems. Physical health complications, ongoing treatments like chemotherapy or radiation, and pain can also interfere with participation and concentration during therapy. The nature of the brain injury itself influences recovery. The location and extent of brain damage determine what functions can be regained or compensated for. Damage to critical areas involved in thinking, memory, or problem-solving can limit the brain's ability to recover those skills. The brain's capacity to reorganize itself, known as neuroplasticity, varies from person to person. Factors like tumor growth, surgery, or side effects from treatment can impair this natural ability, making progress slower. If the disease continues to progress or if treatments cause neurotoxicity, cognitive functions may fluctuate or decline, complicating rehabilitation efforts. Therapy-related factors are also important. Sometimes, rehabilitation programs are not tailored enough to an individual's specific needs, which can reduce their effectiveness. For example, using generic exercises instead of ones designed for a person's unique deficits might not produce the best results. The amount of time spent in different phases of learning matters too. Cognitive rehabilitation involves acquiring new strategies, practicing them in real life, and adapting them for independence. Rushing through these stages or not dedicating enough time to each can slow overall progress. Some approaches, like errorless learning, where patients are guided to avoid mistakes, can help speed up learning, especially for those with memory issues. Support from family and social networks is vital. Encouragement and reinforcement outside therapy sessions can make a big difference in maintaining motivation and applying new skills. Another challenge comes from the complexity and diversity of cognitive problems in brain cancer patients. Many experience a mix of emotional, physical, and cognitive issues that interact and make it harder to target specific deficits effectively. Because each person responds differently to therapy, standardized protocols may not always fit perfectly, requiring ongoing assessment and adjustments. External factors like access to specialized services, transportation, or financial resources can also influence how consistently someone can participate in therapy. Limited access or logistical barriers can slow down or reduce the intensity of rehabilitation efforts. Addressing slow progress involves a comprehensive approach. Healthcare teams need to carefully evaluate each person's unique situation, identify specific barriers, and customize therapy accordingly. It's essential to allocate enough time for each phase of learning and provide psychosocial support to boost motivation. Coordination between oncologists and rehabilitation specialists helps manage medical issues and optimize cognitive recovery. Ultimately, understanding that recovery is a complex process influenced by many factors can help patients and caregivers stay patient and hopeful. Remember, every individual's brain heals differently, and personalized, multidisciplinary care offers the best chance for meaningful progress. Always consult healthcare professionals for tailored advice and support on this journey.